Well, good morning and welcome, everyone. My name is Michael Crane. I'm Medical Director for the World Trade Center Program Clinical Center of Excellence at Mount Sinai. And I want to thank you and all of you for joining us today for this special panel discussion. Today, we will hear from the 9/11 advocacy community and the journalists who have covered the health crisis facing responders and survivors these past 20 years. As a physician who cares for responders at Mount Sinai, I know that we as healthcare providers would not be able to continue the work that we do without the support and perseverance of the community leaders and the reporters who have kept this story on the front pages. I personally want to say to all our panelists, and I want to say this for all of my staff too, thank you for your commitment to the heroes of 9/11. A few housekeeping notes. Under the resources tab, you're going to find the agenda with the bios. There are subtitles available in Spanish, and videos of today's discussion will also be available. If this is your first time tuning into our events this year, I would encourage you to watch the videos from yesterday's program. I was joined on the morning panel by esteemed medical colleagues from NIOSH and all of the World Trade Center Clinical Centers of Excellence. And in the afternoon, a distinguished panel of legal experts discussed the September 11th Victims' Compensation Fund. And we were inspired by the stories of two World Trade Center Health Program members, one responder and one survivor. Their stories are moving and uplifting, and we are so grateful that they shared them. And now it's my pleasure to turn this event over to our moderator, Michael Aronson from the New York Daily News Editorial Board. Michael.
Thank you, Dr. Crane. Thank you, Mount Sinai, for setting this up. If anyone watched yesterday's presentations, in the morning, there was about a dozen physicians and other people involved in healthcare. In the afternoon, I think there were 5 or 6 lawyers, including a federal judge. Today, we're not as fancy. I don't think there are any physicians or federal judges or lawyers here. Who's a lawyer? Oh, you're a lawyer, but you're not a physician. Sorry for the levity. We're going to kind of have a hybrid as opposed to yesterday, where it's instead of just a straight presentation, we're going to have an open-ended discussion. And we do have an opportunity for audience people to submit questions via the computer. We may get the questions. Hopefully they'll be good questions. If we're not able to, it's not because the questions were good, it's because these people have so much to say. I know that I could speak for 2 hours myself about this situation, and I'm sure all 8 of these panel members could. So that's where I want to start it. I'm just going to throw it open. It's now 20 years since this catastrophe in terms of people's health and their lives, beyond those who immediately perished in the collapse. Why did it take 9 years for the Congress to put aside any money for these people? And then why we're still fighting? Before this event, the Senate leaders, Chuck Schumer and Carol Maloney from the House, were outside this hospital urging Congress to pass enough funding to keep this program going. So it's 20 years and we're still not there yet. So I'm going to put the question out. You don't have to be polite. In terms of the bios of these people, they're all available online. They all know lots about this stuff and have tremendous amount of stories, some which they're even allowed to talk about. So the question is on the floor: why did it take so long, and why are we still fighting this battle? Somebody start talking.
The thing will work. I was up in New York for the first 5 years after 9/11, 4 years before I went down to Washington, D.C. And one of the first stories I started covering was the push to get the legislation through. And it was almost shocking to me, having lived through it, but in Washington, the thought patterns are just different. There's a certain numbness, there's a rhythm and a method of doing things that's very political, it's very focused on the specific issues that come out of the, the political brains down there, and they forget about the thing that happened last year or the year before, although they do remember to tweet, never forget every year on the anniversary, or they'll send out the, notification to celebrate, troops on Veterans Day and things like that. But when it comes to the actual policy, there's a certain numbness that creeps in, both in the staff and in the leaders, where they just don't internalize that real human visceral pain. And it becomes all about the partisan issues and the things that they care about and their specific agendas for the lobbyists and the people in their district, and they forget. So I remember going to one of the first hearings where they were proposing the original legislation not that long after James Zadroga had died, and all the questions from folks on the Republican side at this time were
That was what year? He died in 2006, I think.
Yeah, so
right?
this would have been 2006 or 7. It would have been probably the Energy and Commerce Committee. And it was all these questions about, well, how are we going to ensure that, immigrants don't get the benefits? And what if there's a terrorist in there? It was all these sort of talking point things that had very little to do with the real lives of the people and the fact that they came from all over the country that they were concerned about. So those were the sort of very talky pointy things. They were very in their bunkers, and that took an amazing amount of effort by people like John Feal, who kept going down there to break through. So I think that's sort of where it starts from. It's just that very Washington political mindset.
Okay, we're done. Anyways, I want to let the panel speak, but everyone says, never forget, always remember, honor the heroes, honor the victims, waving the flags and the symbols of the Trade Center, but it came time to actually do something. Is it just because we're in New York, this is so obvious, and, New York is one of 49 states are not New York, or, we've got other topics, but just other people on the inertia and the nothingness.
So, I agree with what Mike said. I think for me, two things were really noticeable at the beginning. Am I not on? I thought I was.
Now you're on.
Now I'm on. So I think just to piggyback off what Mike said, I think there were two things happening at the beginning. One is it's absolutely true that DC, the practice of politics is a very depersonalizing process. It's a bunch of people talking about things that they often have no idea of the actual human beings behind those issues. And politics, especially as it's practiced now in DC, tends to basically try to strip all that out and fit whatever you're talking about into some completely different ideological disagreement you have that has, in some cases, nothing to do with anything. So I think there was a depersonalization issue that was really compelling, especially at the beginning. But I also think there was an actual science challenge. And so, not to get too personal or anything, but like my mother worked at the World Trade Center. My mother died of leukemia. But before anyone feels sorry for me, my mother died in 1999. So it had nothing to do with any of this. And I think the first challenge, there was sort of an emotional hurdle to overcome, and then there was a logical hurdle to overcome, which is, one, who are these people? I don't know them. Two, what is this data? What is the science that says this is something we should do, we have to do? And I think in those beginning years, we all knew about World Trade Center cough. Certainly, Mike and I had written a million stories about the types of ailments that seem to be afflicting a lot of these folks. But you couldn't hold up, a report or a study or the types of things that could just say, no, these people are definitely sick because of 9/11. And to a certain degree, I think that's sort of a problem in how you deal with policy in the public debate in the political world, in that a lot of arguments break down over, well, we don't know enough, and until we know enough, we should not act. That is a very common posture in politics. And it gets applied to a whole bunch of stuff, and 9/11 was not uniquely applied to 9/11 health issues, I would say. But over time, you got more science, and it became more clear that there was something genuinely different happening here. And as a reporter, the way I tend to think about these issues is you're never going to have perfect knowledge. The people at this table know more about this issue than probably anyone I can think of. But they don't know everything about this issue because no one knows everything about any issue. And if you sit around waiting for everything to be known, it's going to be 40 years, it's going to be 2041, and a bunch of people will be dead, and then you'll know the definitive answer as to why. And what, as a reporter, I always approach is, well, what would the point of that be? That would have served no purpose to anyone. And so as a reporter, I think what Mike and I and a bunch of other folks tried to genuinely do is find every answer you can. What is the amount of information that's there? And so over the years, the data got better. The data got more interesting and more informative. And the other thing that happened was John Bleep Feal. And John Bleep Feal talked about this stuff in a personal way, and he personalized the issue, and a bunch of people around John did as well. It wasn't just John. But you needed it to be personal. And one of the things that politics is very funny to me, because politicians in some ways don't know how to talk like people, especially practiced politicians. John and others could talk like real people, and they could say, Bob is sick. Bob was not sick before this happened. He is now very sick.
The connection between
Right. And that's compelling. And the other thing that, Mike and I covered a lot of was, for example, the 9/11 Commission. And again, the driving force at people think of the commissioners as the important people in that process. I would argue, no, the commissioners were not actually important in that process. The families were important because the families made it personal, and the families made you realize, oh, there's an incredible amount of personal pain behind this. And what would you say to the people who went through that pain if you did nothing? And so that becomes compelling, but those two things, the data and the emotion, had to move together, and I just think it took a long time for both of those things to sort of build a critical mass.
So let's back it up 5 years. Shadroga, James Shadroga was a NYPD detective who died in early 2016. And a coroner in some small town in New Jersey said in the death certificate that he died from exposure in the days after 9/11 when he was an active police officer down there. But the New York City medical examiner was not saying that. But let's back it up 5 years to that day and the day after. Some of you, I think all of us were in New York, or most of us, some of us were even downtown. Anyone in the city could smell the odor of the fires burning. Just in terms of, I don't want everyone to relay their 9/11 story, but in terms of what maybe Jake and Denis and Juan and obviously John, who was down there, I think, on the second day after you started going, and mistakes we made then. And then I want to get into what was known and what Juan wrote weeks later. And I went back and read those columns that Juan wrote in the Daily News, and it's really tragic because what he had, he didn't know all the facts, but what he pointed out, and Juan's no, pulmonologist, he's a solid reporter, and he assembled these facts and raised these questions, and it was ignored, not just in his own paper, but beyond. And, what could have happened. So, Jake and Denis and Juan and John, and just in terms of what happened down there and what you saw and what you didn't see, obviously no one was wearing respirators. Maybe a handful of people wearing respirators. If everyone had a respirator on, this wouldn't have happened. To the extent, obviously people beyond the site. But Jake or Denis, you want to start?
As you said, can we get this to work? Yes.
You're an electrician, Denis.
I was, and not a very good one, apparently. What the issue was, when we got there, we saw that they had respirators that were like antiques, if you remember that, right? The respirators were very uncomfortable, the type of, and as you mentioned, I did work in construction. Nobody could wear that for more than maybe 20 minutes without taking them off. So there was this whole big push. The operating engineers and a few other unions made this big push to try to get respirators that fit. And they were unsuccessful. I mean, really unsuccessful. Nobody could come up with a respirator that would do the job, even though they did exist, as I understand. They did exist. And then the federal government's response, Christy Whitman at the time, I don't want to blame her directly, but her statements about what exactly happened, what was happening, was so different than what we were experiencing when we were there. You know, I mean, I wasn't, I was there a lot, but I wasn't there as much as a lot of my friends and colleagues were, and Jake will say this as well. Jake's people were there every day. And you knew right away. I mean, when you left the place, you knew you were coughing, you were sick. It was just a disgusting place to be. So when we started to lobby, I'm going to do this quickly. We started to lobby this. We went to Washington, and we went there with this emotional. And John, you know this as well. We went there with this certain emotion that made it very hard for us to understand where people were going, that were in opposition to us. And I felt at that point that it was like this apathy towards New York in general, that we just couldn't change. We just couldn't get past that. Like if there were certain senators, particularly, that we spoke to that just, you know, they had this. Well, New York is a place where bad things happen generally, and we can't really legislate for all the bad things that go on in socially and in the society that is New York. So, you know, it was like this high emotional level, knowing that people were getting sick, knowing that people were sick, going to try to explain that in rational terms when, as you mentioned, we didn't have the backup information, but we knew. Anyone would know. Anyone with any understanding of just human emotions and health in general knew that something had to be done, and knew that we had to fight very hard to get it. The opposition to it is still astonishing to me. It's still astonishing. It's very hard for me to get by that. I think of it all the time.
Well, you know, 20 years later, and when you look back, bad things happen in New York, as you said, but nothing like this has ever occurred anywhere. We had two 110-story buildings drop to the ground, and so many people came pouring. Obviously, the first responders are EMTs or paramedics. And when you got down there, you immediately knew that what was occurring was not going to be good for you. It was so difficult to breathe. As Denis said, as the hours passed on and the days passed on, they were handing out respirators. I'll speak from the fire service. In those initial days, we still felt as though that it was a rescue operation. It was very much a rescue because we were crawling in to every little crevice that we could find. And, you know, to get into some of these areas of the exposures, we were working in nothing more than our T-shirts and our pants to squeeze in. So not only were we being exposed via respiration, but as you could recall, the following days were the temperature was pretty high. And I think we were absorbing many of the toxins right through our skins because we were perspiring so much. So many of our firefighters, fire officers, police officers, our laborers and trade unions who became sick, you know, following that. I remember after being down there for about 30 hours, and we had gone back to the firehouse, and our skin was stinging, actually stinging, and like almost felt like a sunburn. And no one really could understand what was going on. We showered, we cleaned up because we were going right back. And then we kind of realized all that glass that was pulverized. It was almost, I'll give you the analogy like when you work with insulation, glass insulation. So that impact and just trying to search for life, as we recall, we found some of the survivors in those stairwells, and that was the driving force. We couldn't do it alone, obviously. You know, 2 100-story buildings that were put together by tradesmen, and the tradespeople recognized very quickly that they were going to have to get there. They assembled those structures. They were going to have to be an integral part of now taking it apart and looking for survivors. And I think that, why did it take so long? I think as we needed the data, the research to catch up. Certainly that was part of it. But as Mike said, I think what happens in Washington is like with many issues. It becomes partisan politics, and they forget about the issue, and they forget about the human element. And obviously, it was a national attack, and if it wasn't for efforts like John and the other unions, the AFL-CIO, of going down, Ben's efforts, we would have never gotten to where we needed to be. But we had to bring it to the national level, to the people's living rooms, to say, we have people that are sick and dying. And without all those efforts, I don't think that would have been possible.
Kimberly, can you hear me?
So I want to go back and kind of begin, as everyone else has done, from the beginning. And the declaration based on no scientific evidence by Christine Todd Whitman that the air was safe to breathe in the middle of this absolutely unprecedented environmental disaster. Everything that was in the towers was pulverized, was breathable, was, could molecules of it were obviously in the faces and on the skin of the responders. And there was obviously a conscious, deliberate decision to move forward with a plan to deny the dangers. And the agencies that are, the EPA and OSHA, and then we'll take it down to the city level with the New York City Department of Health, the agencies that are tasked with protecting worker health and safety, with protecting human health and the environment, we're following an entirely different plan. And there was a massive fight to get data actually released, real data. And Joel Kupferman, who, basically was smuggled onto the perimeter of the pile in an NYPD t-shirt, got some grab samples and had them analyzed and had industrial hygienist Monona Rosal interpret the findings, and were loaded with asbestos and fiberglass. And because these samples are very expensive, that's all that Joel was able to, analyze for. And, Joel leveraged those results to try to force the EPA to respond to his Freedom of Information Act request. He said, okay, here's my data. And also, and I will throw the ball to Juan Gonzalez, because Joel brought all of the information, and Joel brought the experts that he had cultivated to Juan Gonzalez. And Juan, let me thank you again for trying to blow the lid off of the agency fail. I mean, it was a massive, massive agency fail. And every time we brought that information forward, authoritative information, and every time we, tried to get access to good data or try to actually get the EPA to interpret data. I mean, what the EPA did was, they did a big data dump. And Juan actually was the person who published the story where, experts like Monona conveyed to the public what they were being exposed to.
I just want to going to go to Juan, but Juan had a column in the Daily News with the headline, "Health Hazards in Air Worry
Right.
Trade Center Workers." That was on September 28th on page 6. One of the people quoted in that story was a departed veteran of this institution, Dr. Stephen Levin, who told Juan, this is September 28th, so it's 2 weeks later, that it's very dangerous what's in the air. Juan had a front page of the Daily News on, we're talking about Joel's data, on October 26th. So that was your big front page column. And I'll hand it to you, and then there were some responses printed in the paper from a business group and from Whitman himself. But so Juan?
I think the point that Kimberly makes is important. It's true that in those early days and weeks, it was impossible to prove that all of this stuff was going to get people sick. But it was also impossible to prove that it wouldn't get them sick. And yet the government chose to say that. The government took action based on, as Kimberly says, no science. And a week after the attacks, Christy Todd Whitman says the air is safe to breathe, and tens of thousands of office workers are sent back into Lower Manhattan and we later learned that President Bush himself had ordered that Wall Street needed to be reopened within a week. So there was a political decision made with no science of what the government wanted done. What then happened, in retrospect, as we understand it now, all the public health officials had to make the science fit the policy. In other words, they had to say, okay, the president has said, let's reopen Wall Street. We don't want to alarm people, so we're going to tell them that the air is safe, even though we don't know. And I think that is the key fundamental failure of the public policy makers. There were other failures as well. Yes, for the first 2 weeks, it was a rescue operation. But once 2 weeks are over, look what happened in Miami with the building collapse in Miami. Once 2 weeks are over, and there's almost no likelihood of anyone surviving, it then becomes a different situation. It becomes a recovery situation and a job situation. And because Mayor Giuliani maintained his role as incident commander far beyond the time of the rescue operation, he would not permit OSHA or other government agencies to exercise their responsibilities to protect the workers on the site. So I think that there were failures at the federal level, there were failures at the local level, and also when EPA initially, in response to some of my initial reports and the data that Joel had gotten, a lot of it initially was not from the EPA, it was from the state monitoring reports, because the EPA was holding back on some of its reports, but the state was doing its own environmental testing. And so the EPA said, well, those are only isolated examples of extraordinarily high levels of benzene or these other heavy leads or dioxins or PCBs in isolated areas. The problem is that, first of all, it's an open air. So having any kind of enormous quantities of toxics in open air, not in an enclosed room or in a building, is extraordinary. But there could have been even higher quantities in other areas where there were no test sites. So that once you have that, that's automatically a sign that there's a danger. And I think that, and we later learned that some of the monitoring stations that the EPA had set up had no detects because the filters were so clogged with debris from the air that they couldn't give a reading. That's how polluted the air was down there. So I think that there were failures at all levels, my frustration was, and I remember I mentioned this in an interview recently, that after the first column and the enormous blowback that came from the City Hall and from the EPA, and that my editor started to pull back somewhat, and they were concerned they didn't want to print some of the follow-up columns. And I remember telling Ed Kozner, who was my editor-in-chief at the time, and he was holding back some of the columns, and I said, look, Ed, I don't want it on my conscience that 20 years from now, a whole bunch of people are going to get sick because we didn't warn them that there was a significant potential, not that certainty, potential for them to get sick. My mistake was to think it would take 20 years. It only took 5, 6, 7 years for people to start dying as a result of the exposure. So I underestimated the problem, even though I was accused of being exaggerating. And I just want to, I ended up having to do a small book that came out in early 2002 on this, because I figured that the individual columns wouldn't really express the magnitude of the problem. And so this I wrote, I think, in February of 2002. The early blanket assurances that government officials issued were a grave mistake, and their continued defense of those assurances in the face of widespread public skepticism was inexcusable. Thousands of people may end up paying for that deception through unnecessary illness or premature death in the decades to come. In their rush to return New York City and Wall Street to business as usual, these short-sighted officials unwittingly paved the way for a second wave of victims from the World Trade Center tragedy. In scrutinizing the government response to the collapse, I am not suggesting that there was some secret conspiracy to hide the facts, or that anyone intentionally set out to mislead the people of New York. But I have no doubt that some officials saw what they wanted to see and irresponsibly chose to minimize or dismiss any post-collapse environmental threat. They did so for any number of reasons, or combination of them, out of ignorance, in response to political pressures from their superiors, or because they underestimated environmental threats from toxic releases, something that is all too common in the history of such disasters. Once ordinary citizens questioned their assurances, however, these officials closed ranks, dissembled, hid important information, and refused to listen or alter their policies. My aim here is to outline key lessons of this saga for the general public so that this kind of deception is not repeated should another catastrophe occur in the future. So I think that that's the key thing, that it's not as if we've never had disasters of this type, not on this scale, but there have been disasters of this type in the past, and there is evidence that people get sick if they're unnecessarily exposed to toxins, but the political pressure to reopen the financial industries was so great that basically economic needs were put over public health needs. And I think that that is the fundamental thing that happened here, and it's the fundamental tragedy on top of the original tragedy of the collapse of the buildings.
Well, I just want to agree with Juan. Is it on? Oh, it wasn't on. 100% right. You know, they created this frame and they wanted the frame to fit. But I'll disagree. One thing is, we know based on the work of Anthony DePalma in the New York Times in 2007 that the Giuliani administration predicted that there would be 10,000 toxic tort claims. They knew in October 2001 that there was a problem. So there was an intentional malfeasance. And I think one of the reasons, what Devlin said was 100% right. We didn't have the science. But we didn't have the science because the Giuliani administration and the Bush administration wouldn't even let people ask the questions. And they wouldn't even entertain that there was a possible problem, like you say. You know, in the early days before Zagrova, the delegation, you know, working for Carolyn and with Jerry, the delegation managed to get some initial funding to support some of the work that had been done by some of the clinics like Mount Sinai and like the Bellevue Center. What people didn't realize, and we didn't even realize at the time, when the federal government let those contracts, those are individual contracts to the hospitals, to the clinics, they wrote into it, this was for medical monitoring, it wasn't even for treatment. They wrote into it that the clinics could not aggregate the data. Someone at Health and Human Services in the CDC and the Bush administration thought enough to say, so if you don't aggregate the data, you're never going to know if there really is a problem. You're not going to be able to see it. They wrote into that you couldn't use the federal money to do that. And that was intentional. You know, that was sort of the problem that the delegation was up for when the unions came down, when John came down, you know, it was proving that. And, you know, it took a lot. You know, at the time, you know, there was some people who helped out. One of the people I wanted to point out is Representative Shays from Connecticut. He was the chairman of the subcommittee on national security. Mrs. Maloney was the ranking member. He actually saw this as like Agent Orange, like that the government was hiding what had been done to the veterans in Vietnam. And he actually managed to get the GAO to ask some questions in 2004 so that we actually started to get some scientific backing up for the premise to answer the question.
And Ben, I would agree with you that made it the level
Yes.
of cover-up.
It wasn't your fault.
I was running in February 2002. I
Right.
really didn't believe that government officials would deliberately cover stuff up. We later
Right.
found out, not only from the De Palma stuff, but also from the EPA's own Inspector General report, that it was James Conniton, the head of the Economic Council for George Bush, deliberately rewrote the press releases of EPA. Even the EPA people understood that it was a lot tougher situation than they were letting the public know, but the White House wouldn't let them put out those press releases.
Yeah, I just wanted to ask, John and Ben, that early resistance and that early denial had an impact, especially in those 2005, 6, 7 years. And I'm just curious, since you guys were in more meetings than anyone else up here in Washington, how often that came up and how big of an issue it was?
Well, I mean, I don't think like Juan said, we didn't find out until 2007 the extent of what the city knew. We still don't know what the Giuliani administration knew and didn't reveal. We knew, like in 2004, 2005, what the Bush administration had done to sort of limit the findings. You know, at the time, that was even before the original draft of Zagrova, we were pushing for, the normal sort of appropriations process, which was trying to get funding for treatment, not just for monitoring at the time, but to fund Mount Sinai, to fund the Bellevue, the operation that the city had had. But we were still getting resistance from the Pataki administration. They didn't want to change the frame that they had run Ground Zero well. But at that time, then they were starting to come out the books, from the reporters at the Village Voice, when there was a Village Voice. I don't know, John.
Yeah, I've been here for about 45 minutes, and that's 45 minutes more wearing this mask that they did at Ground Zero. That's fact. Nobody ever told me to wear a mask. I never put one on, and it would have been impossible to communicate.
You were down there, what day did you go down
The 12th to the 17th. As for the facts, that nobody's ever going to know all the facts. If I worked in a bank and my colleague Mary came in to work every day with a black and blue, black eye, bloody nose, and she did it every day for 6 months, you can only fall down the stairs so many times. Her husband's beating her. We saw on the front lines of the 9/11 community people sick and dying. Grown men, macho, burly, mustaches the size of dogs, tattoos on their neck, cops, firefighters, construction. We didn't need science. Science needed us. We didn't have to prove 9/11 made us sick. They had to prove it didn't. We knew all of the crap that they lied. Christy Tull Whitman on September 16th. She has to live with that. The man to the right of me created me. He created Frankenstein. He created Frankenstein. We're at 20 years. This is still the longest day in the history of days that has not ended. We still get disrespected. We still get lied to. We're still doing press conferences to get money added to bills. And this next 20 years, God forbid you're all still here, is going to get worse. It's going to get that much worse for the 9/11 community. The 9/11 responding community will be decimated over the next 20 years. Everybody's worried about today or tomorrow. We should be looking down to the future because we're evolving for the worst. These programs have to evolve with us. We know enough facts and have enough common sense to know that we were lied to in the beginning. We've been lied to ever since. We know that members of Congress who are divorced from reality, who care more about tweeting now than the actual legislative process, who care more about career longevity than Jake's health or my health. This is a pattern. And until you get in their face, until you call bullshit on them, until you make their life miserable, you don't get anything done. It's that simple. And one more thing, the advocates could have advocated and screamed all we wanted in New York and in DC, but if it wasn't for the media like Mike and Devlin and Juan and others, we would never have gotten this done. We would never, ever, ever, ever gotten, because this took a village. This took advocates, this took elected officials, this took the media, and this took the American people finally getting behind us and saying, we're fed up. We saw what you guys did to tens of thousands of people. And we plan on doing it again until as long as we can't do it anymore.
You know, Rudy Giuliani used to say that the cleanup was conducted and no one was killed in the cleanup. I mean, John was hurt, other people were hurt. That's not going to bear out to be correct. You know, no one was, you know, run over and killed by a bulldozer during the cleanup. But if you add up all the people who were down there in those 18 months, and then you start putting in the toll, that the numbers aren't going to be there. John, you were there until your accident. If you didn't have that accident, you would have stayed longer, and who knows what you would have picked up in your body.
I would have been there for the whole 10 months.
And what would have happened to your own health?
You know, I don't know. I don't know if I would have got sick. You know, I know people that were there for 10 months and aren't sick, but I know people that were there for an hour and are dead. You know, everybody's immune system's different,
Right.
just like our fingerprints. That's what makes us different. These toxins, which we absorbed due to nose, mouth, and skin, we worked on the pile, we slept there, nobody went home, we cried there, we went to the bathroom there, we ate there. We were digesting and inhaling toxins 24/7. Didn't need a scientist. You know, we're walking the halls of Congress and they're making shit up and, you know, oh, Feal's a liar, it's in his head, he's crazy, he's a loose cannon. Science caught up to us, math caught up to us and gave us validity. Now I got a PhD of 9/11U. It's almost comical. But for anybody to, you know, when we were there those first couple of days, I saw people with bloody noses, phlegm, coughing up.
Yeah.
The stuff that was coming out of people's mouths.
Or just
and
using
no-
like a wet rag, which wasn't going to do anything, right?
Yeah, yeah, and again, for 5.5 days, nobody ever told me, hey, put this on. It might save your life. You know, I'm kind of glad I got hurt, and while at the time it hurt and it sucked, I'm not sick like everybody else, and it does give me that voice to be a pain in the butt. But there are so many people that could have lived or could have had some sort of longevity if Congress and the Senate would have done this faster. Because of political games, because of incompetence, because of corruption, because of greed, and because of really bad people, tens of thousands of people suffered. That's, we're having this conversation and we're all calm about it, but it's some of the most, it burns me inside. And that's why I'm never going to show Congress or the Senate the respect that they think they deserve. And listen, the New York delegation's my friends. But the rest of them, the body of work, they don't deserve my respect.
Were you? I thought you were saying something. What? Well, these masks wouldn't have helped you if you were down there. You needed the full bore thing, and I remember the 20-minute rule.
Well, look at the Pentagon. Everybody the next day was working in hazmat suits. We didn't get no hazmat suits at Ground Zero.
That's right.
You know, Christie Todd Whitman, Rudy Giuliani, the Bush administration, they are guilty of negligent homicide. There, I said it. Anybody got a problem? They knew we were going to get sick. They knew we were going to die. Rudy's no fan of mine. I'm no fan of Rudy. Trust me, we've had our falling out. Christie Todd Whitman's got to live with what she said. She took orders from an administration that was pure evil. And I don't say that lightly.
And then what they tried to, I went back and read what they said, the EPA, that they said the trade center, the 16 acres, had these dangers, but they were discussing the air generally downtown was safe. Well, even if you take that, I mean, Kimberly is nodding, would you get in here? There are plenty of people who never stepped foot on the World Trade Center during that entire time, but the stuff was in the air. You could smell it. I mean, I want Kimberly to get in here as well as John.
Let me just say one more thing. Even with the bill getting passed in 2010 and renewed in 2015, renewed in 2019, yeah, we got bills passed. It doesn't save people's lives. It gives them a fighting chance and compensates them. But those toxins didn't stop on Houston Street and say, oh, I can't cross the street. They didn't stop at the Brooklyn Bridge. They didn't stop at the water. There is a lot more people sick from 9/11 than we're keeping track of right now, because we have arbitrary dates and we have arbitrary boundaries because Congress is inept and inadequate and uneducated on this issue.
I'm going to say ditto to that. And I'm also going to say that initially, the program that became the Survivor program, the program that treats affected residents, students, and area workers, initially, I mean, there was no program, there was no acknowledgement that people beyond Ground Zero could fall ill. And there was actually kind of a public shaming campaign by public health officials in the Giuliani administration of residents. If you even breathed the word that you were experiencing health effects, certainly on the west side of town, and Catherine Hughes has spoken about this, especially when there was a drumbeat for war, it was considered to be outright unpatriotic to admit, that you were suffering as a result of having either reoccupied your home. And I want to remind everybody that Battery Park City had a 50% vacancy rate. People who had the means to pick up and get out did it. A lot of other residents ended up in housing court where they lost. So people who had evacuated returned to buildings that were clearly not properly cleaned, where they could not get any information at all about the safety of the buildings. And then on the other side of town, you had people who were never evacuated. So, the 12-building New York City Housing Authority complex at the Smith houses, there's a whole lot of illness there. The residents of Chinatown, Lower East Side, had a 3,000-person march where the placards read, no more toxic air, we want health care. There was no recognition forthcoming that people were suffering as a result of exposure to World Trade Center smoke and dust. This occasioned an enormous struggle. Some of that struggle had to do with contesting the EPA's, what we would basically characterize as junk science. And if people want the details, we've got the receipts on that. And in fact, a lot of the insights that we brought forward about the inadequacies of the EPA's cleanup plan ended up in the 2003 EPA Inspector General report. But again, I mean, the boundary lines were political. The Canal Street boundary line for the EPA cleanup cut Chinatown in half. The boundary line for being enrolled in the World Trade Center Health Registry, Canal Street again, cut Chinatown in half, excluded a large number of people whose exposures were significant. And, the initial health program to treat survivors was created through the efforts of a coalition called the Beyond Ground Zero Network, which is immigrant worker centers and residents and workers and advocates from Lower East Side and Chinatown. They approached Dr. Joan Reibman at a talk, and they collaborated with Bellevue, and you got the World Trade Center Health Impacts Clinic, which was really a small pilot program. At that point, though, BGZ was bringing in a very steady stream of affected residents and cleanup workers, and the clinical staff at Bellevue, were examining them and saying, yeah, here's the impact. Eventually, after a much larger coalition, community labor coalition, in fact, began pushing the mayor of New York and also began calling for federal action to create a survivor program. And also, not incidentally, when the Daily News started running stories, where the mayor was, taking it on the chin every day for fighting the claims filed by sick responders, we got the World Trade Center Health Impacts Clinic expanded to multiple sites. At that point, Dr. Reibman was treating residents who were exposed as far north as Union Square. So there are a lot more people out there, people who are actually unable to get access to the health care provided by the World Trade Center Health Program.
Well, the current boundary line for the health program, I think, is Houston Street.
It is.
And I always remember,
In Western Brooklyn.
right, that H for Houston for health, and the compensation program is at Canal Street. So,
Right.
and if you're outside of those boundaries, or
Not
you
allowed.
can't account for your time, you don't get to participate. Having a little discussion up here. In terms of the reaction of the city government, the Bloomberg administration, the Daily News wrote many stories, many editorials. They didn't want to recognize it. Was that just because of the cost of the health care, the health department and the mayor? Why the continued reluctance and refusal and foot dragging to recognize that this is real and it's caused by it? And I remember Dr. Frieden, the health commissioner, says, well, there's no conclusive proof. Now everyone recognizes it. But any observations on that, Ben?
I have to ask them. Throughout, until the Daily News did their series that they got rightfully so got the Pulitzer for the work of, Bev Weintraub and Arthur Brown and that sensational work. I think that they were stuck in this frame that if they were to start to admit that there was a problem, then they were wrong. So the Giuliani administration and the Bush administration had this frame that they've created that they did a great job. And anyone who brought that questions about it, would be antagonistic to them rather than worried about the people's lives. And again, just to be clear, and I think, Jake has made this clear, no one's disputing that there was going to be an exposure in the first few days. I mean, no one's going to have a boatload of respirators or ready, because no one had foreseen this, obviously. But they could have done a better job. We know that the federal government actually offered the Giuliani administration to take over the site, which would have done a lot of things legally, would have taken care of the contractors with their liability. It would have, but Giuliani refused because he liked being in charge. And that was the only reason. And had the feds been brought in, the odds are then the place would have been run better, as Shanksville and as the Pentagon was run to OSHA standards. But because he refused to do that and no one pressed him on it, the Bush administration didn't want to press him on it again, because once they made that initial mistakes of rushing to open, then other mistakes happened, like the idea of opening schools. The idea of opening Stuyvesant while they're unloading the barges in front of it is just, who thought that was a good idea? So I think that once they were stuck until the Daily News dislodged them of that. And then after that, the mayor was very supportive. But I think that they had initial problems at the very beginning, accepting that there was the size and scope of what people were going through and what the delegation was trying to argue.
We just had someone, go ahead, Jake. Go ahead.
Yeah, I just want to comment on what Ben said. I'm a fire officer. I'm not a scientist. I'm not a doctor. But Ben brings up a very, very important point here. And operationally, in those first hours, days, nobody knew who actually was in charge. Obviously, the fire department, the whole department was committed there. We lost our command structure. You had the police department there, federal agencies trying to do investigative work. And also now we were on Port Authority property. So from an operational perspective, no one knew who exactly was in charge while the city was trying to maintain control. And I don't know exactly when, but the Southwest Incident Management Team out of Arizona actually they were flown in at a point in time. And they actually started bringing some operational structure to this incident because it was such a large-scale incident and magnitude that you really needed someone with that type of expertise to be looking at every facet of this operation moving forward.
If somebody had said, you must wear a respirator to get in this site, could that have been enforced? Or maybe after the first 2 weeks or something?
Depends on the day. My experience of it was, my experience of it was the first, let's say the first week, guys wouldn't come off. Guys would work themselves till they passed out and they just wouldn't come off. So I don't think realistically you were going to get much compliance with that issue in roughly, again, this is just a thumbnail sketch, but roughly that first week. But, there's lots you can do. You don't have to just accept that as the permanent state of affairs. And obviously, I think John could probably know far better than I, but I think, guys were feeling the effect right away. A lot of those guys, I think in those first 48 maybe, if you had told them right to their face, you're going to die from this,
They still would have gone.
a lot of them would be like, bleep you, leave me alone.
I'm looking for my buddies.
But that changes. That does not excuse, to Juan's point, that does not excuse what happens in the many weeks and months that follow.
Yeah.
Right, and particularly, who knows when it would have happened, but if people had, the questions Juan raised, or the people, Dr. Levin or Dr. Herbert, who was at Mount Sinai at the time, raised, had they allowed those questions to be asked, we would have responded better. The whole issue of we didn't have the science. We could have had the science a long time earlier had there been work done and had the Bush administration, you know, for many times working for Mrs. Maloney and with Mr. Nadler and bipartisanly, Congressman Walsh from upstate New York, you know, really trying to push the Bush administration to put someone in charge. You know, writing several letters and press conferences to get Secretary, the Health and Human Services Secretary to put someone in charge of the health things, right? That was the initial thing. That's how we got, luckily we got Dr. Howard.
Who's still there?
Who's still there, amazingly enough, who's just been a huge asset throughout this whole thing. But the administration just kept resisting even asking any questions. And, you know, I remember talking to Congressman Shays, he would get a lot of crap from the White House. Why are you asking these questions? You know, so it took a lot of effort on his part to even allow those questions to be asked. And I know that Congressman Walsh had the same issue, and he was an appropriator. He was like a very senior member.
Just want to, John stepped away, but the person who took him away was a behind-the-scenes person named Susie Valentine. Yes. And I want to ask Denis to explain about, you know, his secret weapon of deploying Susie, you know, early on, and how that worked, and, you know, who she is and what she did, and how it all fit into pushing this.
Well, when this thing happened, Ben, we were in communication from the beginning, right, through Carolyn's office, Carolyn Maloney. And what we had to do is find someone, and Susie is, I guess, in the room here still. Susie was really committed to this, you know. She wanted to do as much as she could, so we pretty much, you know, allowed her to do that. She was the political director for the AFL-CIO in New York, but really, I would say, Susie, for that whole 8-year period of time, that's what you did. You ran campaigns, you did other things, but her main focus, and a lot of it was on her own time, weekends and afternoons and such, to organize the labor side of the of this effort. And it became very important because it got really lonely there for a while, right, Ben? When you say that, I mean, there wasn't a lot of people that were doing it. It was basically the firemen, us, and a few construction unions. I was going to say the laborers unions. They were involved in it because the effects that you know, were visible on their members at the time. You know, guys got sick pretty quickly. Men and women got sick pretty quickly. So Susie was there through the whole time, and I would say that the effort to keep this thing going has Susie deserves a lot of credit for it. Susie and Ben, when other people, you know, when there wasn't a lot of interest, because people get disgusted, you know. If you don't see a victory, or you don't see success early, or you don't see progress, people get disgusted and they walk away. It was hard to get people to continue it.
That was really you know, you'd always assume that eventually you would get through. Like one of the issues that you asked earlier is why did it take so long? You know, there are a lot of reasons for it, but, you know, my boss, Carolyn Maloney, Jerry Nadler, they had to stick through it. We would do press conferences out in front of the site, because it was the site at the time, for, you know, years, and we'd have to come up with ways to get stories. Things would happen, you know. I remember when I had to speak to Mr. Zagrova about whether I asked for permission to use his son's name. You know, trying to keep it in the news and keep the pressure on, and it was very difficult. I mean, we would do things, we did the typical, what's called a Lenny Slotnick, you know, what Reagan did, which was to, I think it was 2004, 2005, we had responders and survivors who would get gallery passes for the State of the Union. The members all get a gallery pass. So we would give a bunch of responders down to, highlight this, to sort of put pressure on the Bush administration. But you get kind of tired doing that all the time. But again, we would keep doing it simply because we would see the evidence of people. We'd hear the stories from the unions, from the survivor community about people who clearly have health impact that they were living with and living with till today.
I'm wondering, Ben, if you could talk a little, because I don't know if people who are listening in know the attempts at a character assassination that occurred in reference to Zadroga and the Zadroga bill and the battle that Carolyn had to wage to insist that that would be the name of the bill.
Sure. So, we saw the newspaper story. I think, we saw a story, not in the Daily News, in a New Jersey paper about the medical examiner. I think it's Warren County or something in New Jersey. So, here was some hard evidence. A medical examiner made the determination the first time, and, we called and we used it. And the initial bill that, I guess it's like 2007, but then there was press stories about, that Mr. Zagrova had misused his prescription drugs. And, we knew, but for 9/11, he'd be alive today. I mean, that was just it. I mean, one of the things, I'm not a doctor, and Dr. Crane is probably here. I can't say with scientific certainty that Ray Pfeiffer died of 9/11. I can't say that Louis Alvarez, it's scientific certainty, because you just can't. People die of cancer. But it's pretty scientifically certain now, to talk about the science, that it's highly likely that but for 9/11, they would not have died earlier. They would still be alive.
Yeah.
And, I say that because that was, but for, I was talking to Ken Feinberg, because James had actually gotten a compensation under the original VCF. He's one of the few. There were, most of the people who got awards in VCF 1 were obviously death cases. But Ken actually gave him the maximum amount he could, as if he was dead. That's the way Ken explained it to me, because he could tell that he was going to be dead in a few years. But there were people, and I'm sure people used it, like Juan says, and approached Congressman Maloney, and she refused because it would have been disrespectful. But a lot of people called. A lot of people, politicians said, "Why are we doing this?" But for 9/11, he'd still be alive.
This reminds me, when I was a young reporter in Philadelphia back in the 1970s, because someone had mentioned Agent Orange and the parallels, I think, with how the government responded to the American soldiers who were inadvertently sprayed with dioxins from Agent Orange when the U.S. was in the Vietnam War. And I remember one time reading in a Time magazine article that the health minister of North Vietnam, this was after the war had ended, was conducting a study of Vietnamese troops to see if the Vietnamese had been affected by Agent Orange. And they were doing a study of Vietnamese soldiers who had fought in the South and of comparing to Vietnamese soldiers who had never been in the South, therefore had never been exposed to Agent Orange. So I write a letter to the Minister of Health of North Vietnam telling him, listen, I'm a reporter from Philadelphia, I'm interested in your story, because I had been doing some Agent Orange coverage back then. And months went by, and I never heard anything. Then suddenly one day, I get in the mail from Vietnam the report that they had issued, all in French, of the study that they had done, and which clearly documented that among those North Vietnamese who had gone into the South, the rate of miscarriages, of babies born with deformities, of all kinds of other illnesses was much, much higher than those who had stayed in the North. So I go to my editor at the Philadelphia Daily News at the time. I said, look, we're the only people in the United States who have this report. We should run something on it, right? And she said, no, that's coming from Vietnam. That's communist propaganda. I said, this is like the Minister of Health. I mean, I guess he's a doctor, you know. And so we never ran the story, right? And I think the thing is that it takes the science sometimes time to catch up with the reality, the proof. But the people on the ground, as John said, knew it right away. They knew that they were being affected by this, and it was important to listen to them and to do whatever was possible as quickly as possible to prevent their getting even more sick because they weren't the intervention didn't come in at the right time.
But it's still, I keep thinking about the timeline. So the disasters in September 2001, 02, 03, 04, there's more evidence. I think I went back and read some of the earlier coverage. There was a police officer named Officer Goby, I think, had died in 04. There was an EMT, Debbie Reeves. And then when Detective Zadroga died, it was actually his union, the Detectives Endowment Association, that really made a big push. And this county coroner brought it up, against the New York City medical examiner, which is, the world standard, and there was a disconnect. And I remember we had an editorial in the Daily News that here's this Zadroga situation. We wrote, someone should look at this. And, months later, we realized no one was looking at it. So one of my colleagues, as Ben mentioned, Bev Weintraub, decided to go look at it. She spent weeks and weeks and months. She found the evidence which was sitting there. Dr. Kelly had written, these studies that had evaluated the lung capacity of the firefighters because, thank goodness, there was an annual physical required by department doctors of every member of the department. So they had, from A to Z, they had your lung capacity in 98, in 99, in 2000, in 2001, 02, 03, and they saw these drops. And it was like, that was real science. I remember getting on the phone and calling the even larger New York City Police Department. I spoke to a doctor who's still there, Dr. Kleinman, the chief police surgeon, and I found out that the police department didn't have any records. The police department at that point, I'm not sure now, does not require annual physicals by department doctors. There was no before and after. And I said, but thousands of police officers were there. He said, well, we had an event at Kingsborough Community College, and we invited people who thought they were sick to come down, and it was all nothing. It was like they didn't want to focus. And now, clearly, many, many times more police officers are going to die from the disease than the several dozen who were killed that day. And but for those records of the fire department to hang it on, so we wrote all these editorials. Bev Weintraub took the lead with Arthur Brown and Heidi Evans, and that was in 2006. And Hillary Clinton said, "This is great. I'm going to push on it." She was the big senator. 2006, 2007, 2008, nothing. The Democrats win. They're in power. Obama's there. She's Secretary of State. They control both houses of Congress. 2009, nothing happens. 2010, nothing happens. The Democrats lose both houses of Congress. Now they decide, oh, maybe we should do this. Maybe we should do this.
That's exactly.
And
That's an abbreviated version.
well, I'm trying to compress, but it's like,
In 2009, when Bush was president, there was no real way to path forward, and obviously, because, not making it partisan, but when the Republicans were in the majority, it wouldn't. But once 2009 and we got the majority, we did start to get movement. Frankly, there are people, again, as John says, it takes a village, and it was kind of lonely, but once we were in the majority, Congressman Lofgren from California took the first action to start taking the legislation that Congressman Maloney and Nadler had written and actually started to move it. That was the reopening of the VCF. That was 2009.
The compensation fund, right.
The compensation fund, but it was in one, we felt it was important that they both be together. You can't have compensation without also medical treatment. So we had to keep them together, but in Congress, going through two committees is like exponentially difficult. So Zoe Lofgren went ahead and did this, moved the bill, and then the problem was the Energy and Commerce Committee was working on the beginning of Obamacare, so there was a logjam there, but eventually Congressman Pallone moved the bill, and we put both of them together and passed it in the House, and then that's 2010, and we did lose the majority, and that's when Senator Gillibrand managed to get it despite a filibuster from Senator Enzi and Senator Coburn, because the House had passed it finally for a 10-year program for I think $7.4 billion total. But in order to get past...
But the passage was after the election, right?
The passage in the Senate was after the election. It was like they were packing up and headed out the door, and my old boss, Senator Schumer and Senator Gillibrand managed to, with the help of obviously Jon Stewart and Shep Smith of Fox News, really sort of created enough pressure on them that they couldn't leave town.
December of 2010.
Yes.
And I think Jon Stewart, I think he devoted his whole show to it. And just like, why are these Republican senators blocking this for these firefighters and other people, and it broke the logjam. Everyone
Susie provided the producer with the people to hear.
Somebody want to get in? Go ahead.
I want to, I just want to,
Dennis, is the mic on?
yeah, I think the mic, is mic on? We can't tell.
There's a little light on.
Yeah, I'm on now. In the time we have left, there's another factor too. The whole factor, and this was sort of a bogus factor from the whole thing, was the idea of cost. We were talking about science, but we always ran up against this wall of, well, what is it going to cost? Then there were the pay-fors and all the things that the Congress throws in your way. I remember, I think, Ben, you were with, and I know Susie was there too, and a number of other, when we went to see President Bush's director of the budget. His name was, I forget his last name. He became the governor of Midwestern state right afterwards. And he said to us basically that, well,
Mitch Daniel.
yeah, he said the cost, remember he said the cost is prohibitive. You're never going to get this done. It just costs too much. And we were like, are you, we couldn't believe that somebody would tell us that you're never going to get it done because of the cost. We had been fighting about the need for all this time. Now we're talking about, all right, well, maybe that's right. Maybe the science is right. Maybe all that stuff is right. But the cost is just too much and you can't get it done, which really drove us crazy. But I want to go just quickly, and we're still dealing with that now. There was a press conference this morning. See, the cost of this thing is still a factor that everybody fights with. And we're still dealing with that same objection, and that is the cost. How much money is this going to cost? Where are we going to find the money? When we find the money to do all kinds of things. So the fight is definitely not over, first of all. And second, we have to continue to push so this thing is permanently funded and meets all of the inflationary requirements that we need to move forward. As time goes on, these things cost more. And now, in this it's 20 years, whatever's left of this, the conditions that people have are going to be much more expensive because they're much more severe as people get sicker and sicker and sicker. So we can't really, we talked about where we were, but the slogan says look into the future, moving forward. We have to realize that this fight is nowhere close to over. We have to continue to fund this concept, this program, because if we don't, if we lay off, it's not going to happen. And Ben's, the organization that's sponsoring, that Ben and Susie work with, put this in place. It's very important to have long-term lobbying plans when it comes to the Zaroga Act and this issue in general, because over time, I mean, people forgot about it when we were lobbying it, right? I mean, they're going to forget about it moving forward, and that would be
Didn't we
terrible
pass that
tragedy.
already?
What?
Didn't we pass that already?
Yeah, didn't
I
we,
mean,
that's what people say, didn't we pass that? But again, let's focus on the cost, making sure that we have the money to continue to move this forward. That's what keeps me awake.
And that's always been a problem. My hope, and maybe I'm optimistic, is, we've gotten past that. I mean, we now have legislation that has, AOC and Elise Stefanik on it. So I'm hoping that the Congress, even though, the problem is it's a new generation, it's the same.
Yeah.
Someone earlier today said, well, why are we pushing it now? The program will, the issue isn't until 2025. Well, frankly, we wanted to do it now, so we knew that there would be a lot of attention to it, because in the future, there may not be that attention
That's right.
for it, and the problem is still going to be there. The Congress, there are a lot of people who work very hard, and a lot of them work hard on this, but the Congress as a whole has a short attention span. And, now is really the time to sort of resolve this so that, God forbid, John or responders to the fire union going to have to walk the halls, under COVID. I'm just hoping that that's not going to have to be the case because, in the middle of a pandemic, we're going to make these guys do this again. It's just wrong, to, the survivors, as well, so.
I just want everyone to be able to have a few words before our lights get turned off in about 10 minutes. So just Kimberly, Mike, Jake, anyone, just.
Well, there's one positive note that I could offer as we go out of this thing, and that's that all the work that went into this legislation has sort of seeded the ground for problems like this in the future, and I think Ben's involved in it now, but burn pits around the world where our troops have been fighting have been making hundreds of thousands of people potentially sick with, jet fuel, burning plastics, human waste, similar things that you found with the World Trade Center, and it's been very difficult for them to get the treatment through the VA. So some of the same staffers who put together the 9/11 legislation took the 9/11 legislation and the old dioxin legislation from 1992, I believe it passed, and there's new bill that has that presumption in it that doesn't wait until you're dead to say you deserve help. So that's sort of an interesting legacy that comes out of this, where I think it's going to be a lot easier for Congress to get that legislation through and help an even larger population than 9/11 responders and survivors, because millions of military troops were overseas around burn pits that, contractors were allowed to just set on fire, and the president's son. So, that's sort of a
100%.
positive legacy of all this, and if you're looking forward, it might actually be easier for some of these big disasters for people to have programs set up for monitoring to happen and for money to be set aside with a presumption, expecting that, yes, toxins make people sick. So there's a little bit, there is some good that may come out of this.
That's exactly the point. I mean, we've learned that unless you get the presumption, and that's what Senator Gillibrand has done in pushing the issue, that John and John Stewart are also involved in trying to, use what we did and the pattern of it and the science of it. And actually, there are a lot of researchers that have done work on 9/11 that are also doing work on burn pits as well to provide the science. But, regrettably, we learned a lot. I know Senator Gillibrand staffer Brooke Jameson, who really deserves the most credit for getting it through the Senate, who just left working for Senator Gillibrand, really, helped draft many of those same things in Senator Gillibrand's burn pits bill to give the presumption, because if you leave it up to, to the institutions, there's going to be this inertia not to let it happen.
And you're going to lose years. Kimberly, did you want anything before we go out?
I did. And this is in no way to downplay how important it is to get this legislation to provide care for burn pit survivors. But wouldn't it be great if we could stop the military from setting all this material on fire, which is happening in the United States and military bases as well? I mean, this stuff is really incredibly toxic, and it will make you sick, often in ways that are terminal. So again, we are always, we come from the ounce of prevention. And I guess I also want to say that, we also, in terms of lessons learned, I really think we need to start moving forward from the precautionary principle. I mean, you presume that a hazard is hazardous until you show otherwise. Because if you don't do that, then you're basically going to end up with the same result that we have here. Finally, I really want to raise the issue of children. So one of the reasons why we need a long-term strategy is that, in fact, there are more than 35,000 children who were exposed either as residents or as students to 9/11 smoke and dust. And, the EPA and the DOH got off to a very, very bad start. DOH issued a public health advisory in late September that was in a Q&A forum, and the question was, do pregnant women and young children need to take additional precautions? And the answer was no. Pregnant women and young children do not need to take additional precautions, which on the face of it, I mean, you don't have to be an expert in pediatric environmental health to know that that is completely Orwellian. So I think...
And we know they weren't wearing respirators, too.
For sure not, even though there's a very famous Art Spiegelman poster of a little girl in a respirator, and I think the headline is, New York City to Lower Manhattan children don't breathe. So they did breathe, and they were brought back to schools within blocks of Ground Zero. Lila Nordstrom has written a book about this. There was this hue and cry for everything to get back to normal. And of course, what's being normalized here is risk, really unacceptable levels of risk. And even children who were well-known, well-established in 2001 that they were the most vulnerable to harm from exposure to toxic substances were just, subjected to incredible danger. And what we have now is that they're really not being followed by research at all. And this needs to be corrected. The community has been calling for research, particularly on the physical health impacts to people exposed as children, because again, the research on responders is absolutely critical, and always like spearheaded by Dr. Prezant, the responder research leads the way. But you can't use responder research to figure out,
right.
what the health impacts might be for people who were exposed when they were 5 or 15.
I think we the final minute or two, so we got to go real quick. Devlin, or?
So I just wanted to say, because I was listening to Juan talk, and I realized I remember when reading for the first time Juan's first column, and I remember my initial reaction, not as a person, but as a reporter, was, well, that's all very nice, but it's too soon for that. Like, I gotta check out 5 terror, 5 suspicious package reports a day.
Anthrax,
we don't
right.
have time we don't have time to worry about this right now. We got more threatening things to go on. And I do think the long arc of this issue, of the 9/11 health issue, is that it took all of us a little while to figure it out. Some people figured it out very quickly. I was not as smart as Juan. I needed more Juan columns before it made sense. And his revenge was I ended up writing about the issue for years. And so...
you're still writing about it.
And I'm still writing about it. But I think, on an optimistic note, I do think, like, if you look at where we started, there is a much better understanding of the issue now, and to the point about burn pits, and to the point about, whether or not there should be more money. I do think you have seen a tremendous progress. I get that there's a lot of frustration in the room and elsewhere that it took so long and that it was so hard and so many people had to work so much at it. But I'll be honest, I do think what folks, not me, but other folks in this room accomplished and outside this room accomplished was they accomplished a great deal for those folks, and they're going to Mike's point, make it much easier for these types of issues to be tackled better in the future, so that the next time someone like Juan writes a column like that, it's not going to take necessarily 9+ years to get to the other end of that process. And I think that's, probably a good thing.
Denis, I'm not even sure if we're still on the air anymore, but... Get the light.
He was with us throughout. His expertise on the issue was essential, and we lost him too soon. I just wanted to acknowledge the work that he did.
All right, I think we have what we have the last say. I mean, obviously, there's no last word on this. You know, this 90 minutes, because this bill is still not passed, and as everyone's pointed out, there's a lot more people who could get a lot sicker and then die. And, you know, what could have been avoided with other types of hazards, and all the terrible mistakes that happened with this, and then where we started, why it took so long. We all know why it took so long, and hopefully, you know, people who come after us will realize you have to start right away when you see something that's dangerous. I want to thank everyone, and I want to thank Mount Sinai for setting this up. Thank you very much.
Thank you.